Hey guys, Luis Moreno here with 360 Insurance Group. We're going to talk about free leads for ACA, under 65 health insurance. Before I talk about this free lead program, I need a couple of things from you. You got to like this video, post a comment, and most definitely you got to subscribe to this channel. Okay, I'm constantly putting videos out there for you guys. Down below, click on the description, and I've got a few things that I've created for you. Number one, I created a Smartbook. Okay, everything you need to know about ACA and how to write business. I got the federal poverty level chart for 2023, and I got a bunch of stuff in that book that is a great reference when you're writing business. I also have one for Medicare, so hop in there. Also, I partnered up with a lady who has done great on my Facebook social media post on my ad program, and she cut my ads by a third in cost. Okay, so I'm getting more ads for the same amount of money. And so I asked her to create a course for us agents. So I've got some information down below on that course if you're interested. And then the other thing that I have for y'all is my CRM. I use Agent CRM for all of my marketing and even for my existing business when I try to stay in contact with all of my insureds. So it is a great tool to have, and you'll see the information down below in the description. All right, so let's get into this, guys. This is going to be awesome. Free leads for ACA. All right, so let's talk about that program. All right, so it is called Help on Demand. Okay, I got this email from the marketplace from CMS, and they've updated their program. Okay, they even have a course that I would suggest that you guys do it. It's about 40 minutes. It's not too long, and it's really gonna give you some insight into how Help on Demand works. But here's what I'm going to share with you. So how does Help on Demand work? This is what happens, guys. So a consumer can decide to go on Help on Demand. I'm sorry, to healthcare.gov. So they decide not to use an agent. They want to go and they want to enroll themselves. Now, guys, I will tell you, I have a PDF that I've created that I can share with you guys on the 7 reasons as to why an insured needs to use an agent. There's 7 misconceptions that they think, and I will tell you the biggest one that I see is that they think they're going to pay more by using an agent. So anyway, we got to share with them that that's not the case. The rates are the same whether they go direct or they utilize us as their agent so that we can assist them in choosing the right plan. But anyway, so they go to healthcare, they go to healthcare.gov and they start their application. Now, what happens is the consumer starts entering their information, trying to complete the app. Now, what will happen is if they get stuck anywhere on there, they can ask for help. Okay, so they go on there and they ask for help. What Help on Demand is, it's going to match them with an agent, and usually the match is created geographically. Okay, most of the leads that I have received have been people that are around a mile from my office. Okay, so whatever address you use when you do your certification on portal.cms.gov, and I'll show you what that looks like here in a minute. That's your home base. From there, I guess there's a radius, and it depends on how many agents there are in the area. Who knows what the algorithms are, but you will get people that are literally in your neighborhood, which is great. Now, so they'll go on there, and what they will do is they'll ask for help. Now, Help on Demand will alert you, okay? And you choose whether you want an email alert, you can choose whether you want a text alert, or both, okay? Now, the crazy thing is that you only have 15 minutes to accept this lead. That's it. If you don't accept it, then it gets rejected, and it goes back into the system and it gets sent to another agent. Okay, so you got to be on top of it, guys. Your text messages, your emails, I like them by text because I'll get the notice and I can hop right in there and I can claim that lead and call them up and start working on it. So if you accept it, then what you're going to do is you're going to contact the insured or that potential lead immediately. I pick up the phone and say, hey, Mrs. Jones, this is Luis Moreno with Simply Health Insurance Agency. And you are on healthcare.gov trying to complete your application and you asked for help. So here I am. I'm a local agent and I'm here to help you. How can I help you, Mrs. Jones? And then they'll go into it and they'll start the process. And then what you need to do is you need to get into the application. That's going to be primary. Number one is you need to look, we have no idea what they've entered or if it's correct or not. So you got to ask them for their name and their date of birth. You can get their permission to get into their application, get into that application. And then what you will do is you will proceed with completing the app. Okay. It is literally that simple. And all you've got to do is claim the lead. All right. Where are you going to go to get this set up? So you're going to go to portal.cms.gov. Okay, so you go there. This is the same site where you go do your certification if you're participating or if your state is participating in the federal marketplace. There are 14 states that do not participate in the marketplace. They have their own state exchange. Colorado is one of them, California, I think Oregon and Washington, Kentucky, I think, has their own, and a few others. Okay. Could be wrong. I'm just going off memory there. But in those states, you have your own exchange. This is not going to work for you. Okay. So what you'll do is you will log in. Okay. Once you're logged in, what you're going to do is you're going to click here on this button, Marketplace Training Agent Broker. Again, you should already be certified. Okay. And so you'll click here. And then what it will do is it will pop down below this window. You make sure that you choose MLMS. I've never done these other ones, guys. So I always go here, MLMS training. CMS continues to offer training, blah, blah, blah. Just click on that. Once you've done that, guys, here is what's super important. You are going to hop in here and you're going to choose, you're going to fill this information out. Okay, so you're an agent broker. I would like my contact information displayed. When you click on this, there's 4 options. There's one of them that says, you don't want anything displayed. Okay, which means you're not going to be part of the help on demand. Okay, and it tells you here, find local help and help on demand options. So I chose, I would like all my contact information displayed, but only for my home state where I have a valid license. Okay, I enter all my office information here. I put my hour of operation, guys, 7 in the morning and 9 p.m. at night. Okay. You do not have to mess with this business entity and this web-based entity. Guys, just don't even do the drop downs there. Okay. Once you fill that out, you hit save. Then it will take you to the next screen. Okay. Your screen is going to look just a little bit different in this sense. Okay. Since I already had done the training, this PY plan year 2023 help on demand is going to be down here at the bottom. Okay. You're not going to see it over here. When you click on it, then it moves over here to this side. Okay. That's the only difference. Okay. So be on the lookout for this. You're going to hit open curriculum or you'll click on it. Then it'll move over here. Then you're going to hit open curriculum. Okay, then you'll see here where it says health insurance marketplace help on demand plan year 2023. You'll hit launch and then you will start the course. Okay, complete the course, guys. Get 100% of it and you're done. Okay, now this is the back office side of help on demand. What you will do here is you'll log in. Okay, a couple of things here you're going to want to do. You'll notice here, I got some leads that came in at 11:45, 2 o'clock in the morning, 3 o'clock in the morning. I don't know what happened here. 3:14. Well, I will tell you. Well, no, I don't know. I think I was on spring break during that time. And then 12 o'clock at night. Okay. So sometimes, or no, 12 o'clock in the afternoon. Couldn't tell you why I missed these, but I missed them. So those referrals expired on me. That means they went to another agent. Then down here are the ones that I did accept within that 15-minute time window. Okay, so just make sure you have this set up. Make sure that you have your availability turned on. Otherwise, if it's off, you're not going to get any referrals. Okay. I did miss view metrics and export metrics. It just kind of gives you an idea of if you're a numbers person where you can go and see some information there, but I don't even mess with it. On your profile, guys, this is where it'll have your information on here. You're going to enter your phone number where you want to receive those texts, your provider, and then you're going to put down here the email, how do you want to be contacted by email and text. So you definitely want to have this set up. Okay. Then also down here in availability, guys, I would set up your hours. Okay. Make sure that you have your hours set up. I have mine set up, and I guess I shouldn't because I'm not working at 12 o'clock at night. Not doing that anymore. I used to, but I opened it up maximum. I'll probably end up making this a little more accurate, but you can hop in here and fix these hours correctly so that you get you make sure that you're available during that time to receive leads. Guys, it's pretty simple. Free leads, you cannot beat that. Okay. Now, a lot of times I usually get between 20 and 30. I'm in a big city with a lot of agents, so there's a lot of competition. There are some cities, guys, where you're not going to get a lot of competition. Okay, you could get a ton of leads. So it doesn't hurt you. They're freebies, guys. Take advantage of it. So with that, I'll finish off with, I need a little love from you. Subscribe to my channel, like the video, post a comment. I do check them. I do reply back. And then check my description down below, guys. I got a lot of goodies. I got a Smartbook for the ACA and for Medicare. I've got that Facebook course that I created with that lady, and Agent CRM, which is my preferred CRM. I love that sucker. It works great for me. I mean, it cost me $97 a month. I make my ROI on it is huge. It does a lot of work, and a lot of work for me. And if you use my referral link, I've got some assets that I'm going to share with you. My ACA workflow, my ACA pipeline, and a bunch of templated emails that I use for the ACA business. They give all that to you for free when you sign up using my link. And it's the same price whether you use my link or not. So take advantage of it, guys. With that, thank you. I appreciate it. And good luck.